Hello, Assalamualaikum. It's Dr. Masuma Mehta. Welcome to my YouTube channel Medical School. Today I'll be discussing about acute renal failure and its basic concepts. So let's start. Acute renal failure, in short ARF. So this is severe decrease in the renal functioning. Now the word acute has been used here. So you can think that it's sudden onset, but remember this onset is very sudden. It can occur in few hours to days. Now what are the hallmark of this condition? That is azotemia and oliguria. So the word azotemia is a medical terminology. It's used as a medical terminology and it means that it's a biochemical abnormality that leads to the elevation of nitrogenous products within the body. That is to say, the nitrogenous waste products accumulate within the body and that's why it is elevated. Now the most important products are creatinine and PUN, that is blood urea nitrogen. And as we know that oliguria means decreased urinary output. It's less than 400 ml per day. It ranges between 80 to 400 ml per day. So recalling the normal output that ranges between 800 to 2000 ml per day. So types of azotemia, we have pre-renal azotemia, intrarenal azotemia and post-renal azotemia. Before discussing these topics, I would like to discuss few important things that I have used in these slides. So let's begin with GFR. It's glomerular filtration rate, that is described as the rate filtered in ml per minute. So the normal GFR is 90 to 120 ml per minute. Now the blood urea nitrogen, it's just the concentration of urea and nitrogen within the blood. So its normal level ranges between 5 to 20 milligram per deciliter. Now come to the word creatinine. Creatinine is basically a waste product of creatine. Now creatine is a protein that helps to transform the ADP to ATP and its waste product is creatinine. Now the normal level ranges between 0.5 to 1.1 milligram per deciliter in females. But as the males are more muscular, then the level is slightly increased. It ranges about 0.5 to 1.3 milligrams per deciliter. Okay, so the blood urea nitrogen creatinine ratio is a ratio of these things in milligram per deciliter. So the normal ratio is 5 to 20 ratio 1. Come to the fractional excretion of sodium. It's the percentage of sodium filtered by the kidney which is excreted in the urine. Now this means that how much salt is being excreted in the urine. Remember it's not a test, it's just a calculation. So the normal FENA is approximately 1%. Urine osmolality, it's an index of concentration of particles excreted in urine. Through this terminology, we get to know about the urine is concentrated or diluted. So the normal value ranges between 275 to 295 milliosmoles per kilogram. Now come to the topic which is pre-renal azotemia. So it occurs due to decreased blood flow to kidneys. Remember that there are some conditions that result in decreased blood flow to kidneys. However, if the blood flow gets normal, the kidneys may function normal. But in this case, there is decreased supply to the blood flow towards the kidneys and that's why the kidneys are not functioning properly. So it results in decreased GFR and oliguria, and again we have azotemia. So in this case the ratio is greater than 15, that indicates a problem like hypotension or hypovolemia. So the hypovolemia may include the burns, as we know that the skin is a protective covering of our body. So whenever it is exposed, the body fluid can be evaporated, and then the hypovolemia condition can occur. Then we have pancreatitis, that is necrotizing type, and when the patient is using excessive of diuretics, it may lead to hypovolemia. Then we have severe diarrhea and vomiting that may lead to dehydration. And then we have hypotension. So in this case we have sepsis, hemorrhage if there is blood loss, and congestive heart failure, which is a very important cause of pre-renal azotemia. Come to the renal azotemia. Now in this condition, the parenchymal tissues of the kidneys are damaged, and that results in decreased GFR. Now in this case, the ratio is 15 or less than 15. The important causes includes acute tubular necrosis, in which there is tubules. As we know that the nephrons contains tubules which are very necessary for the reabsorption. So in this condition, the necrosis occurs within the tubule. The second condition is glomerulonephritis. In this, the glomeruli of the nephron undergoes inflammation due to antigen-antibody complex deposition. Then we have chronic renal failure and rhabdomyolysis. Come to the post-renal azotemia. This is caused due to obstruction of urinary tract below the kidneys. Now remember, this obstruction can be externally by means of enlargement of tumors and enlarged prostate in the case of male, where the urethra is being suppressed. Now it can be internal obstruction due to stones resulting decreased GFR, oliguria. Now remember, in early stages it's not very complicated. In this case we have ratio greater than 15, tubular function remains intact, and the FeNA is less than 1%, and the urine osmolality is greater than 500 milliosmoles per kilogram. But in the late stage is somehow complicated, as in this condition the tubular damage ensues and the ratio is less than 15, decreased reabsorption of salt, and salt excretion is greater than 2%. As we have already discussed, in this condition the tubules are being damaged, so the tubules are unable to reabsorb the salt. Then we have inability to concentrate the urine, so its concentration decreases, osmolality decreases about 5, that is less than 500 milliosmoles per kilogram. Now the clinical presentation of acute renal failure is decreased urinary output, and number second one is fluid retention. There will be edema, there will be shortness of breath, the patient will be complaining of nausea, weakness, and heartbeat irregularity. Okay, so this was all about the acute kidney failure. If you have any question or query, you can ask me in the comment section. Thank you so much.